Hello everyone, I'm Dr. Pavithra, fertility specialist at GarbhaGudi IVF Center, Nagar. Today, I would like to talk to you about male infertility. Male infertility has progressed from the last 20 years. So if we go back 20 years back, we saw that male infertility was around 20%. It was contributed by male infertility. Coming to the present scenario, male infertility is 40%, female infertility 40%, and combined or unexplained infertility another 20%. So why such a drastic increase? Why there is so much of doubling? Why there is so much of male infertility coming up? So let's talk about the various problems faced. First, when we see the lifestyle changes. So not just our own lifestyle, it is also about the environment which we live in. So as you see in our environment, the pollution has increased, the use of plastic, the pesticide usage. These various factors contribute to male infertility also. The endocrine disrupting factors, the usage of Wi-Fi all around the clock, and the IT professionals using laptop, bank workers and drivers and continuously sitting. So that again causes a lot of heat towards the testes, and that again causes male infertility. Again, coming to occupation, in case of occupation, the ones which work with heat, that is chefs or temple priests, or it could be firefighters, the mining or any other profession where there is a lot of heat. So in these cases, the testes get damaged, and because of which the spermatogenesis, that is the formation of sperms, becomes very low. Other factors like your habits, so smoking, tobacco chewing, alcohol, all these are also very damages the sperms and the process of spermatogenesis. So apart from that, what all other causes? So we are coming to see a lot of sexual dysfunction. So it could be in the form of erectile dysfunction or hypospadias, where the penis of the male is very short. So these are the conditions where the sexual dysfunction takes place. So what are the reasons for the sexual dysfunction? It could be because of diabetes, which is where India is the diabetic capital, and we are seeing around, initially it was only 50s and 60s where diabetes was most prone, but now even at the age of 30 we're seeing patients with diabetes. Apart from diabetes, it could also be the thyroid. Thyroid again contributes to the quality, that is the low quality in the sperm parameters, because there are receptors of the thyroid present in the Leydig cells and in the Sertoli cells of the testes. Coming back, again prolactin, that is again a hormone where high levels of prolactin cause erectile dysfunction, and these also contribute to the sexual dysfunction. So apart from that, there is obesity. Obesity again contributes to erectile dysfunction. And one of the main causes is again smoking. So apart from that, what are the other causes of male infertility? There is a disease which is called as varicocele. So what is this varicocele? When the testes fail to get blood supply or improper blood supply to the testes, where the damage happens and followed by the problem of spermatogenesis, which leads to male infertility. So in varicocele, we have different grades. It's also not just by various ultrasounds. It can be even physical examination can tell us whether there is a varicocele which is present. So varicocele again has a lot of examination, as well as there are treatments, and probably after the treatment, the varicocele repair, which is called the varicocele repair, the male infertility can be reversible, or at least they can try naturally or in the simpler form as an IUI. Coming back to other causes, we already spoke about diabetes. So diabetes not only causes erectile dysfunction, it can also cause problems in the sperms, that is in the semen. So what are the problems? Meaning it could be a low sperm count, or the motility can be very low, or the morphology can be abnormal. So apart from that, thyroid patients also suffer from the same. Apart from that, Obesity again, it causes erectile dysfunction as well as the semen parameters comes down. And this is mainly because the abdominal fat actually insulates the testis. So because the testis usually is 1 degree Celsius lower than the entire body temperature. So when there is a temperature variation, these reasons cause the male infertility. So apart from that, there is again causes like it could be an unexplained infertility. So these are the various causes when it comes to male infertility. And coming back, male infertility, whether it can be treated, well, it depends on the condition, and it also depends upon the age and also the time, that is the duration of the disease. So again, when we talk about treatment, first is the investigations. So what all investigations do we do for male infertility? So first the foremost basic test would be semen analysis. The semen analysis paints a picture, that is, it tells about the sperms, the count, the motility and the morphology. So based on that, we suggest whether other tests need to be done, like an advanced test called a DFI, that is DNA fragmentation test, which tells about the breakage, whether there is any breakage in the sperms. And apart from that, other tests like hormones. So in hormones, we can test about the male hormones and also the FSH and the LH, the various levels which tell us regarding the kind of disease, whether it can be treated medically or whether surgery is required. And apart from that, we can also differentiate between obstructive as well as non-obstructive. So obstructive, in case of any scrotal Dopplers or a scrotal scan, if there is any obstruction, there are reconstructive surgeries which will help us to retrieve back the normal status. So apart from that, if the hormonal status is something which is not curable through medicines, that is through injections and medicines, then again we do have surgical retrieval. Here what we do is there are surgeries where we do on the testis so that we can retrieve the sperms, do a biopsy, see the biopsy through a microscope and preserve the sperms, and we can even do an IVF. So these are the various tests and these are the various treatments when it comes to male infertility. Thank you.